Welcome back to the morning show on JTV. It is my pleasure now to be joined by the Dean of the College of Nursing at Baker College, Maria McCormick. Good morning.
Good morning. Thanks for having me.
So today we're going to talk a little bit about nursing and address maybe the shortage of nursing and a little bit about what Baker is doing. So welcome to the morning show.
Thank you. It's great to be here.
So tell me a little bit about your background in nursing.
Sure. That's a long story,
Sure.
but I spent about 30 days in the NICU as a baby.
Oh, wow.
And growing up, nurses were the hero. My parents talked about how influential nurses were in our family and just in the care that was provided to me as an infant. And so from the earliest age I can remember, I wanted to be a nurse.
Wow.
And so stepped into nursing. My passion is pediatrics, and I spent about 15 years working in the emergency department in pediatrics. Through that kind of started to think about how else can I impact the nursing profession and make that lasting impact, and academia really was kind of the next draw for me to be able to impact the next generation of nurses and really impact the care that we're able to provide to patients.
What pathways does Baker offer students who are interested in nursing?
Yeah, absolutely. We have a lot of different pathways. We have our traditional nursing programs, both the traditional pre-licensure and then the accelerated program for individuals who have a previous bachelor's degree. We also provide options for nurses looking to advance their career, whether that be through the RN to BSN or RN to MSN tracks, or even other various master's degree programs for nurses who already have a bachelor's degree.
That's amazing. And with your experience, of course, the students, I mean, they get to learn so much. The new technology, everything's changing so much. How different is it from when you were coming up through nursing school?
Yeah, absolutely. The integration of simulation, of that hands-on learning, and really that safe lab environment to be able to allow students to practice in a comfortable environment and then go into the clinical setting. Our students have opportunities to practice in a variety of clinical settings throughout their education, from pediatrics, obstetrics, med-surg, mental health, to really create that well-rounded experience that allows them to feel comfortable competently stepping into the nursing profession.
So how can students, how can they choose the right program?
Yeah.
There's so much out there.
Yes, there are so many programs. So things that I encourage students to consider is looking at that program, looking at their accreditation. Are they a nationally accredited program? Looking at the clinical opportunities and partnerships that are provided. We have some great partnerships with community colleges to help with seamless transfer options for individuals. Looking at scholarship opportunities with some of our clinical partners as well provides a really great opportunity for students when they're looking at programs.
How about some of your partnerships throughout the communities in which you serve?
Yeah, so we have some great partnerships with our community partners that allow students to see various ways that healthcare impacts our community. We have great partnerships with community colleges that allow scholarship opportunities or transfer opportunities for students as well, looking for that more non-traditional path.
So let's talk nursing in general. Maybe we'll take a look at the state, and some of it can be anecdotally, but
Sure.
what are you seeing firsthand as far as a nursing shortage in our state?
Yeah, we're definitely struggling nationally and in Michigan specifically with the nursing shortage. Things like an aging population requiring more nurses to care for that population. We're seeing high levels of retirement, especially as our nursing profession ages. Burnout from the pandemic, we all know kind of the impact that had as well on the nursing profession. And we're also seeing some faculty shortages as less people are going into academia, not able to necessarily meet the demands of the students. We're privileged at Baker to have amazing nursing faculty that are really invested in our students and providing that real well-rounded experience for them.
Do you ever run across some students that remind you of yourself?
Oh, for sure. That's what kind of gives me the passion and the drive, is seeing that aha moment, seeing that passion where you have somebody whose life has been impacted by a nurse or their family's life has been impacted by a nurse, and that really develops that deep passion for caring for others.
Well, it's great Baker is offering so many of these different pathways, and I know information is available on your website. People can find out about all of these different pathways and opportunities that I'm sure there's a lot that folks don't know exist.
Yeah, I encourage you to check out baker.edu and look at the different campus options. We do offer nursing at 5 of our campuses and various programs. Our RN to BSN and MSN programs are fully online, so that's great for the flexibility, allowing individuals to continue working as well while they continue their education.
Have you seen some folks switch careers and want to get into nursing?
Yeah, for sure. Sometimes people are coming back for that second career, and that's the great thing about the flexibility of our programs is we try to be flexible in scheduling to allow individuals who maybe have families or have jobs that they need to maintain to also still be able to come back and pursue that dream of nursing.
And of course, what everyone would want to hear is, how about job placement?
Absolutely. Absolutely,
we know
yeah.
there's a shortage.
There's job security, yes. And the beautiful thing about nursing is that it's flexible. You can, the variety of career opportunities, whether that be outpatient, inpatient, ambulatory care, there's such a variety, school-based. You can really do so many different things, and you can change. You know, get sick of one thing and you can move to a different area that meets the needs for your family or yourself at that time.
Awesome. Maria, thanks so much for joining us. And if anyone wants to learn more, they can, of course, visit baker.edu/nursing. More of the show right after this break.